Hello, my name is Melinda Ewing, and I am doing a presentation on opioids crisis in America. I'm an Indiana State University student in Community Health Nursing 444. In today's presentation, the learning objectives are: explain how opioid crisis started, describe how the medication Buprenorphine works, list the ways chronic pain can be treated without narcotic pain medication, identify the economic burden for opioid use disorder, discuss the different ways naloxone works, differentiate the ways of the opioid abuse crisis in America. Compare the side effects of how mental health plays a role in addiction. This is a link to my pre-test. Take a moment and give it a go. Good luck. How did the opioid crisis begin? The opioid epidemic began in the year 1991 and had various waves of overuse. Opioids were meant to treat chronic and severe pain. Originally, narcotic medication was only used to treat cancer pain. Another wave in the opioid epidemic was in 2010, with an increase in deaths from heroin abuse. Since making synthetic opioids like fentanyl, over 20,000 deaths have occurred. The opioid crisis continues today. The percentage of Americans who develop opioid use disorder, OUD, are 8 to 12%. Substance use disorder is also on the rise at 1.7 million people who are affected yearly. In the year 2017, 47,000 Americans died of an opioid overdose. What are the other issues associated with opioid abuse? Opioid use disorder is often associated with injection of heroin. When abusers are not able to achieve the same high, they often switch to harder drugs, such as heroin, and sometimes even fentanyl, and a derivative of fentanyl on the streets. Other problems that are associated with opioid use disorder are some people take larger amounts of the medication than they are prescribed. Giving up or reducing activities such as work or school. Using opioids in physically hazardous situations. As we all know, most opioids do not operate heavy machinery. Building up a tolerance, which includes the need for more. Unsuccessful attempts to cut down. Craving the urge to take opioids. And also, there's experiencing withdrawal. So what can be done to reduce the deaths of opioid use? Reduce the amount of opioids after a surgical procedure. This has been discussed in many different situations as surgeons are now starting to decrease the number of narcotic medications after such surgical procedures. Discuss the risk factors for prescribing opioids for chronic pain, which we all know there are many risk factors such as addiction, constipation, nausea, vomiting, itching, and the list goes on. Discuss with the patient what level of pain is acceptable. Sometimes dealing with chronic pain, there has to be a number that should be acceptable to each and every patient. This is something that should be discussed among many providers in dealing with chronic pain patients. Offer holistic approaches for chronic pain. There are many of them out there, such as acupuncture, acupressure, there's chiropractic, massage, there's aromatherapy, OMT. The possibilities are endless. The only problem is the amount of money it costs with these procedures. Initiate counseling when prescribing opioids for pain. Oftentimes, many people with chronic pain suffer mental disorders, such as depression, anxiety, and the list goes on. Most of the time, after coming home from a combat situation, veterans often just want to feel numb, so they take extra amounts of their pain medications. What is the burden on the taxpayers? An estimated $179 billion in 2018 has been the result of paying for lawyers, health assistants, mental health cases, homelessness, abuse, childcare, and again, that list goes on as well. Buprenorphine. This is a drug that has been much talked about recently, as it can help to reduce the risk or overdose. It binds to opioid receptors and prevents the brain from experiencing withdrawal. It can also diminish the effects of physical dependency. Buprenorphine increases safety in case of overdose, and it lowers the potential for abuse. How is buprenorphine used? It comes in tablets that dissolve under the tongue. It also comes in a buccal film that dissolves through on the cheeks. There also is a long-term implant device that can last up to 6 months. Here is the link to my flyer. I am a strong believer that one of the main causes of this particular drug addiction is the pharmaceutical industry, as they have pushed the providers to prescribe this medication, not knowing how it affects individuals with things as addictive personalities. Other times, pain management clinics don't often address the heart of the issue, which could in fact be a mental disorder. So if you or someone you know who is struggling with opioid use disorder, get help before it's too late. Thank you. And these are my references.